Good afternoon, everyone. I have the pleasure to open day 2 of the next Pharma Summit. My name is Beverly Smet, and I will be co-presenting today with my colleague Jan Keuppens. We are both senior VPs at acrosshealth. So the topic of the session today is about how to engage through omnichannel in the next normal, and we will illustrate this with some successful high-impact case studies. So before we dive into the topic, just a brief slide about acrosshealth. So in essence, we are a consultancy that is specialized in everything related to omnichannel insights, strategy, execution, and impact measurement exclusively for the life sciences industry. And to support this process, we have developed, as you can see at the bottom, a unique suite of products that are nicely integrated into this ecosystem. So you see one of our flagship offerings at the bottom called Navigator 365, which in essence provides our clients with the relevant omnichannel affinity insights of their target audiences, but also goes beyond insights thanks to our planner and tracker tools, which also facilitate in the omnichannel mix planning and furthermore also impact measurement process. Scala 365 is one of our other flagship offerings, which I would say addresses another important need in the industry. So it's all about omnichannel upskilling. So Scala 365 is a state-of-the-art self-service learning environment that enables both marketing, medical, and sales teams to upskill themselves with omnichannel. All right, so let's get started. I think the ultimate question that many of my clients have today is, how will my customers want to engage with pharma once things return back to normal? And for sure, there have been some companies that clearly saw some business opportunities because of the pandemic, like this orthodontic company that basically launched the campaign, Best Time Ever to Get Braces. But also other companies potentially see the future a little bit more grim, such as Fisher-Price, who launched a work-from-home playset during the pandemic, potentially preparing our kids for a life working at home. But now I think probably if we just close our eyes, not everything will be back to normal. So let's have a look at the pharmaceutical industry. So if you look at the slide, you see that before the pandemic, I would say digital was incrementally added to the traditional channels, being mainly face-to-face and congresses and meetings. We firmly believe that post-COVID, digital will become a much stronger integrated component as part of the overall mix, but still also having the traditional channels being important in the future. And if you look at a robust sample of close to 3,000 specialists in our Navigator data, we actually see that during the pandemic, the tipping point has been reached already for promotional interactions, where 55% of specialists prefers omnichannel engagement with pharma as opposed to face-to-face only. And for medical education, you can see that it's even 2 out of 3 specialists that prefers omnichannel moving forward. And probably the biggest impact that we have seen over the last year is a significant reduction in field force access. But at the same time, I think there's also positive news to bring, where we see that the majority of EU5 specialists, for 84% to be specific, actually is open for a digital compensation for reduced rep engagements. So does this mean that the field force will be dead, that physicians have developed an aversion for the field as a result of the crisis? Well, probably not, in my opinion, because what we're looking at here is a retrospective analysis where we looked at some key pharma-owned channels in terms of impact and reach during the pandemic and compared that to the situation before the pandemic. And if you look at the face-to-face channels, being the rep visit, the local scientific roundtable meeting, and the MSL, obviously they have gone down significantly in reach in just 1 year. But at the same time, if you look at the x-axis, the impact of those channels did not necessarily go down. But on the other hand, what you see is that digital channels increase significantly in reach and also in impact. And look at, for example, the Pharma scientific webcast. It kind of doubled in just 1 year time and also further increased in impact. So I believe it's not going to be or, but digital is probably going to be a much more integrated part as part of the overall mix that you need to compose towards customers. However, if you look at the previous slide, it might look like, all physicians are going in the direction of wanting more omnichannel. I do think it's important to also flag that you need to be aware of the swan effect in your customer data. And I think that's nicely illustrated on this slide, where we looked at a sample of EU5 pulmonologists and looked at their communication preferences before the pandemic and during the pandemic. And as you can clearly see, there is a segment of customers initially preferring a mix of face-to-face and digital that evolved more towards face-to-face only. And also the opposite is true, where you see that some face-to-face only customers evolve towards a mix or digital only. So I think customer level channel preference dynamics will be more than ever important in the future. So in conclusion, I think the answer cannot just be about pumping up the digital volume. I think moving forward, pharma companies need to avoid so-called digital fatigue. It should not be only about looking at increasing your share of voice through digital, but definitely also paying sufficient attention to the quality of voice in terms of digital communications.
Okay, thank you, Beverly. So you talked about what pharma companies should be doing. A pragmatic, evidence-based company as we are, we try to keep also up with the pace of change within the industry. So we, on an annual basis, conduct a research in which we try to surface the hurdles, the challenges, the level of investment in digital that is happening through the companies and what your peers are doing in the pharma industry. It's called the Maturometer, a research which we have been conducting for quite some years now. If we look into what pharma is doing, and we compare the level of investment since 2015, the level of investment in digital transformation, and we use the investment in digital budget as a proxy for that, you see on the gray trend line that since 2015, the digital investments have gone up significantly, 93% more budget compared to 6 years ago. As a proxy to what is the return of these investments, we look at, is it paying off with regards to the service satisfaction of your healthcare professional audiences? Beverly briefly talked about the Navigator. From our Navigator market research, we know what the average digital satisfaction is of European healthcare professionals. And you can see that since 2015, there's an upward trend, but not the same steep peak like the digital investment. Let's look at, like they said, Virgin, happy employee, happy customer. Let's look at what you guys think about your digital transformation ambitions and about the programs that are going on within your organization. This is the yellow line. Whereas the healthcare professional, so your customer and prospect satisfaction is going up, it seems that you and your colleagues are struggling and are not completely satisfied with regards to how pharma is trying to keep up with the pace of change. We even, from an internal satisfaction point of view, went below the 2015 levels. What could be the root causes and what are the challenges that we need to focus on in order to instigate and facilitate further change within the organization? Quite a crowded slide, but there are two axes. The bottom axis tells you what the maturity level is of the pharma companies that we have been talking to. How do we measure the maturity level? Well, we expose you and your colleagues to a few statements, and we ask you to what extent you agree or fully agree or disagree with a particular statement. As you can see from the research that we did this year, 80% of the people in our maturometer research agree or fully agree to the statement that their company has a very strong vision towards digital transformation. That is the bottom axis. If we look at, since we were trying to spot trends over the past 5 years, we compared the pain points from 2018 to the pain points of 2021, and that's the bottom left corner. The bottom left corner shows you what domains are immature within your organization and are stable at the same level of 2018. So they remain the pain points, or they're even worsening. The bottom ones are worsening, and typically we see that pharma companies struggle with the fact of having well-trained staff to be well equipped for this day and age of digital transformation. Second to that, another pain point is that apparently a lot of you express your concern around the fact that your company does not have a solid methodology with regards to how do you bring in the synergetic effect of off and online. How do you have an approach that allows you to optimize your channel mix in this day and age of COVID? Another one which I would like to touch upon is keeping your customers happy is knowing what they want from a format, content, service perspective, but also from a communication preference and channel affinity perspective. 3 out of a few pain points that deserve our attention, for which the product suite that Beverly talked about in the introduction can definitely help you out. Scala to beef up the knowledge with regards to digital, channel mix decision making and channel mix optimization, our navigator.
Okay, thank you, Jan. So let's have a look at some success stories, specifically in situations where there was restricted access, like we all experienced over the past year. First case study I would like to talk about is about a top 10 company based in Germany and marketing 2 brands towards GPs, so one in asthma, one in pain. And both of these brands, they were approaching the end of the life cycle, and the company was confronted with a 50% reduction in field force. And they came to us with the question, well, we used to do 140,000 rep visits in Germany, and next year we can only do 70,000 because we lose 50% of the field force. So what we did is we composed an omnichannel campaign that was capable of meeting that share of voice ambition level. And we released that campaign to a specific group of GPs in Germany. And then the other group of GPs in Germany was only exposed to the field force moving forward. And as you can see, in this specific situation, we clearly demonstrated that even in the mature life cycle stage, omnichannel works. Whereas for product 1, we realized an increased sales of 20% above expected carryover sales, and that even outperformed the face-to-face only group by 7%. And for product 2, also there, we exceeded the expected carryover sales with the omnichannel campaign by 13%. And this was more or less on par with the impact on sales delivered by the face-to-face only group.
Thank you, Beverly. Let's teleport to MedTech. We're talking about a European challenge for the cardiac powerhouse in MedTech, where they were launching a percutaneous treatment for a highly prevalent heart condition, and where, with regards to scarcity of resources, they were facing the challenge that this new treatment was a direct competitor to heart surgery, and where their referral base was the entire European Cardiological Society. So they had very few in-field team members, so physical persons, human faces running around, and they needed to convince the entire European cardiology population that for this new percutaneous treatment, this could be a valid treatment option compared to the classical surgery. We created a multi-channel campaign in the first phase, all about awareness raising, educational assets. We hosted webinars, we had self-service portal in place, etc. We partnered with the right third parties, and we realized that after 18 months, we were sitting on top of a wealth of information. The true power of a sound omnichannel approach is creating the synergetic effect between your marketing multi-channel initiatives and the in-field reality. So what did we do? We created a smart tool for your sales teams. So instead of them blindly shooting at their portfolio of physicians that they needed to reach out to, they only stepped into the practice at the moment that it made most sense, meaning they prioritized their visits based upon the level of engagement that the physician had demonstrated in our multi-channel campaign. Okay, Jan, nice story. What about results? You talk about synergetic effect. In our campaign, and this is Germany, if we compared and we used as a proxy for success and proxy for prescriptions or sales, we used the number of patients that were referred to a specialized center to be screened for this particular treatment. The group that was only exposed to the campaign, we saw a referral uptake of 10%. The traditional group of physicians, cardiologists, and cardiac specialists that were only visited face-to-face, we observed a growth of 13%. But the group that used this smart lead prioritization approach, next best visit thinking, you can see that the sales success was 3 times as high compared than if we would deploy the multi-channel campaign as a side initiative to what the sales teams are doing. Third case study, teleporting to Russia, Obgyn, obstetricians and gynecologist market. A company, a pharma company, talking to acrosshealth and saying, hey guys, as with for other companies, we're facing the challenge of commercially paralyzed organizations. We're locked out of hospitals. We want to maintain our share of voice and remain in the pen of our main prescribing audiences. Sadly enough, we cannot go and visit them. Can we use your intelligence, your consultancy, your market research to compile a channel mix to maintain the level of share of voice and demonstrate that at a lower cost to serve, we can have a positive impact on prescriptions? So we went about creating a compensating campaign that in the first phase replaced virtually the visits that did not take place. And if we look at the results, you can see that throughout the campaign, we were capable of maintaining and even growing the share of voice with regards to the outreach towards Russian obstetricians and gynecologists. But instead of solely relying on leading indicators like how many patients did we reach through the webinar, how many web visitors did we have, etc., we factored in a qualitative appreciation of the campaign by deploying a call center campaign where we asked healthcare professionals about their prescription intention for this company's 2 main brands. And what did we see? After the campaign, that the cost of serve dramatically dropped and the upside in terms of prescription intention was 20% higher prescription intention on average for both brands. I think a very successful case study for the Russian gynecology market in COVID context. Speaking of COVID, Beverly talked about it in the introduction. I think the time to reinvent yourselves is now. Never let a good crisis go to waste. Whereas success and valuation of commercial entities used to happen with regards to the EBITDA that you realize, I think there's a new component which needs to be factored in. How smart and how capable are we at reinventing ourselves and creating a solution for the corona reality that we have been facing for quite some months now. If you dream of snapping back to the old normal, there's a lot of market research demonstrating that a certain group of physicians is perhaps in denial with regards to how the future will look like. We can tell you, not gut feeling based, but based upon the market research that we have, that we need to take a leap together with regards to what we call the next normal, the new omnichannel reality in pharma. Navigator 365, the binding tissue between what it is that you're trying to achieve from a brand or medical perspective and the translation towards your channel mix optimization, the rollout of your content strategy, etc. 4 key components: success ingredients to successful omnichannel engagement. What channels do I bring into a mix? What content and context do I consider for a specific channel? How do I complement my own coverage by partnering smartly partnering with third-party media partners? And fourth big success ingredient: how do we outsmart our main competitors, the competitive benchmarking bit. If you are interested, please reach out to us. More than happy to provide you with a demo, or provide you even with test access to our Navigator platform. AcrossHealth on timely basis hosts a lot of topic-specific webinars. Feel free to take a look at our website. The next upcoming webinar that will take place end of October is around omnichannel launch excellence. But in the past few months, there has been a wide variety of very interesting topics that have been discussed by industry experts and senior consultants within AcrossHealth. Okay, closing off well in time. Hope you found it inspiring and thought-provoking. The maturometer research that I talked about, keeping up with the change within the industry. What are my peers in the industry saying around the key challenges that they are facing in this day and age of digital transformation? Just pay us a visit at our virtual booth. And if you're interested, you can get your free copy of the latest maturometer research report that is available for free. Wishing you a pleasant afternoon. Reach out to us in case of questions and pay a visit to our virtual booth. Thank you, Beverly.
Thank you, Jan.